everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about cerebral palsy. So basically, cerebral palsy is a motor function disorder and it might be present at birth or short after birth. So it might be congenital or it can be acquired. And it is caused by permanent non-progressive brain lesion. So that means whatever damage is there, that won't that won't worse after birth. So whatever damage is there, that won't progress. It is non-progressive damage, and it is a non-curable lifelong condition. So basically what we understood is that it is a motor function disorder and it affects the brain, right? Now let us understand the meaning of cerebral palsy to understand it in a more better way. So here we have two words, that is cerebral and palsy. So first let us focus on cerebral. Now cerebral is basically from Latin word cerebrum, and which means here in cerebral palsy, cerebrum is the affected part of the brain. So you know that there are different parts of brain. So here basically in cerebral palsy, what would happen? This particular part, which is cerebrum, would get affected. And then there is palsy. Now here in palsy, we actually have two terms. So we can divide this into two terms, that is para and lysis. Now what is para? Para means beyond and lysis means loosening. So here what would happen, there would be lack of muscle control. So there is presence of loosening which is beyond an average level, right? So what is happening here? The muscles, don't have any strength. So there is lack of muscle control. Now what we understood from this meaning that, cerebral palsy means the first thing is that the cerebrum would get affected, and the second thing is there would be lack of muscle control. There would be loosening of the muscle, or there won't be any strength of muscles. So basically, cerebral palsy is a heterogeneous group of movement disorders. So this is not a single diagnosis. Here, what would happen, there are a lot of things which might get affected. So what are the things that generally gets affected, if a child has cerebral palsy? So the first thing would be movement and their coordination. So the coordination would also get affected, and the muscle strength, which we have already mentioned that there would be lack of muscle control, right? There would be loosening. So because of that, there would be muscle, the muscle strength would also get affected, and the balance and posture. Now, as we already got to know that here in cerebral palsy, the cerebrum, this particular part of the brain would get affected, right? So what is happening here? This part, that is cerebrum, would not be able to work properly, right? Because that has lesion and it is damaged. So what would happen here? The brain would not be able to send appropriate signals to the muscles about when it has to relax or when it has to contract. So what we understood is that cerebral palsy is a non-progressive disorders resulting from malfunctions of the motor centers and pathways of the brain. And why it happens? It happens due to damage of growing brain before or during the delivery or after the delivery. So if we see the incidence, we would be able to understand that the most of the cases occurs before birth. So almost 75% of the cases of cerebral palsy occurs before birth, and 5 to 15% happens during birth, and then 10 to 20% happens after birth. So here what we can understand is that before birth is really common, right? So almost 75% of the cases occurs before birth, and what we can see is during birth it is less common. Here the only 5 to 15% of cases occurs during birth. Now let us move to the risk factors. Well, so here in risk factors, we have several risk factors. So first, let us discuss about the prenatal factors. Now, the prenatal risk factors can be hemorrhage. So if there is bleeding or hemorrhage in prenatal period, that can also cause cerebral palsy. And then if there is abruptio placenta. Apart from these things, if there is infection, if there is any sort of infection which might cause lesion in the brain, or which might damage this particular part of the brain, that again there is a chance that the child might get cerebral palsy. And then if there is any sort of viral infection like rubella or cytomegalovirus, or if there is toxoplasmosis, all these things might cause cerebral palsy in a child. And then there are certain environmental factors and also maternal characteristics which might cause cerebral palsy in children. Now, next let us see what are the maternal characteristics that might cause cerebral palsy. Now, the first thing is age. So here, if there is advanced maternal age, in that case, the risk is more. Like if the mother is having advanced age, in that case, the child would have more chances of getting. And then again, if there is difficulty in conceiving, so if there is any sort of factors which makes the process difficult, then again there is a chance that the child might get cerebral palsy. And then next is if there is multiple births or multiple pregnancy, and also if there is history of fetal deaths or miscarriages, and then if there is cigarette smoking, like history of cigarette smoking in the mother, also alcoholism and drug addiction. And apart from these things, if the mother is mentally retarded, in that case also there is a chance that the child might get cerebral palsy. Now next let us discuss about the perinatal factors. So here in perinatal factors, if there is hypertension or hypotension, that would be considered as a risk factors. And again, if there is umbilical cord coil, or if there is a history of breech delivery, and in case if there is over sedation of drugs, that can also cause damage to the cerebrum. Next thing is trauma. For example, if there is forceps or vacuum delivery, in that case, if during the delivery, if there is any sort of trauma to the brain, that is again considered as a risk factor for cerebral palsy. And also if there is complications after birth or complications of birth during the birth, if there is any sort of complications, then again there is a chance that the child might have cerebral palsy. So next let us discuss about the postnatal causes. And here in postnatal causes, the first thing that we have is trauma or head injury. So if during this trauma, or if due to this head injury, if there is damage to this particular part of the brain, that is cerebrum, then again that might cause cerebral palsy. And apart from this, if there is infections or lack of oxygen or stroke, or if there is tumor or cyst, these things can also cause cerebral palsy. So anything which is which might cause damage to the cerebrum, or which might cause trauma to the cerebrum, then again there is a chance that the child might get cerebral palsy. Now moving on to the signs and symptoms. So here basically we have early signs and late signs. So first let us discuss about the early signs. And in early signs, so what we can see is that there will be stiff or floppy posture, and then there will be weak sucking. So if you see the child sucking mother's breast, you can see the child won't be able to suck properly. So the sucking reflex would be really weak. Now what is tongue thrust? So here you can see the child would push the tongue forward between the upper and lower teeth when the child will swallow. So that is what is called as tongue thrust. So we can, in a child with cerebral palsy, we can see tongue thrust, and also there will be feeding difficulties. And then there will be poor head control, and the child will be extremely lethargic or irritable, and also there will be presence of high-pitched cry. So these are some of the signs or symptoms which are considered as early signs. And apart from these things, there are also several signs and symptoms which might be present in a child with cerebral palsy. So the first thing that we can see is that the inability to perform motor skills as indicated. So that means how their age would progress, based on that they won't be able to perform the motor skills. As we have already learned that this is cerebral palsy is a motor function disorder, right? So here what would happen, the motor function would be impaired, right? So that is why here in the signs and symptoms also we can see that there would be inability to perform the motor skills as indicated. So that means based on their age, their it won't progress. Their motor skills won't progress. And then there will be abnormal developmental patterns. So for example, we can see excessive arching of back. Also, there is a classical feature what we can see, that W sitting. So what is W sitting? Now here the knees will be flexed and the legs will be extremely rotated. So W sitting is also very prominent in a child with cerebral palsy. Also, we can see the child walking on tiptoe or hopping, and the abnormal developmental pattern starts after 1 year of age. So that means after the infancy period it starts. Well, so these were some of the signs and symptoms which might be present in a child with cerebral palsy. Now, apart from these early signs and whatever signs and symptoms we have seen, apart from all these things, there are certain features or certain problems we can say which might be present if the child has cerebral palsy. So, when the child is having cerebral palsy, we know that the part of the brain, that is cerebrum, is affected here, right? So what would happen? There are several, abilities which would get affected. So the first thing would be hearing and visual problems. So the child might have hearing and visual problems, and there would be sensory integration problems, and also the child will have failure to thrive. And there will be behavioral and emotional difficulties. Also, there will be communication disorders, bladder and bowel control problems. There will be digestive problems. So you can understand there are a lot of things which might get affected due to this condition, right? So also these skeletal deformities or dental problems, these also might be present. And apart from all these things, there might be mental retardation and learning disabilities, and also there will be seizure or epilepsy. So all these signs and symptoms might be present in the child with cerebral palsy. So let us conclude our today's topic here. So the rest of the topic would be discussed in a different session, and today we discussed about the meaning of cerebral palsy, what actually happens in cerebral palsy, and then what are the risk factors that contribute to the occurrence of cerebral palsy, and then we learned about the signs and symptoms. So I hope you have got a better insight about the topic. Thank you.